If you're over 60, every heartbeat counts more than ever before. In this video, you'll learn exactly how to survive a heart attack, even if you're completely alone. You'll discover the 5 life-saving steps that doctors wish every senior knew. We'll reveal how to recognize the first warning signs, what to do instantly, and what never to do. You'll also hear inspiring real-life survival stories from seniors who lived to tell the tale. And most importantly, you'll understand how to protect your heart for the rest of your life. So stay with us, because what you learn today could save your tomorrow. Now, let's begin. The human heart beats around 100,000 times a day, quietly keeping us alive. But for millions of seniors around the world, one unexpected moment can change everything. It begins with a strange pressure in the chest, a heavy feeling, a sudden sense of unease. Many dismiss it as gas or fatigue. They wait, hoping it will go away on its own. But in those first few minutes, your decisions can mean the difference between life and death. This video could save your life or the life of someone you love. Today, we explore how to survive a heart attack when you're alone, especially after 60. We'll uncover what happens inside your body, what you must do instantly, and how to recover safely. Stay with us until the end. Every moment of knowledge adds another moment to your life. And before we continue, please like this video and subscribe to our channel. Your support helps us reach more seniors. Now, let's start by understanding what a heart attack really is and why it strikes without warning. A heart attack happens when the flow of blood to a part of the heart is blocked. The heart muscle, starved of oxygen, begins to weaken and die within minutes. This blockage is usually caused by a buildup of fatty deposits called plaque inside the arteries. When that plaque ruptures, a blood clot forms and stops blood flow. That's when pain begins. For seniors, the risk is higher because arteries naturally stiffen and narrow with age. Medical experts call this condition atherosclerosis. It silently develops over decades. Often, the first symptom is the attack itself, which is why awareness is everything. In these next few minutes, we'll go deep into the 5 most important steps to survive. Step 1. Recognize the signals. The body speaks, but we must learn to listen. Not all heart attacks begin with crushing pain. Some start quietly, with discomfort or fatigue. You might feel pressure in your chest, shortness of breath, or sudden weakness. Pain might move to your neck, back, jaw, or arms. Sometimes it feels like tightness or heaviness. Older adults and women often experience subtler symptoms, nausea, dizziness, or a sense of dread. If you feel something isn't right, never brush it off. The body rarely lies about danger. Doctors say, time is muscle. Every minute you delay, your heart loses more tissue. Let's imagine this moment through the eyes of someone named George. George is 68, retired, and lives alone. One night, he wakes up with chest pressure. He feels a dull ache that spreads to his left arm. He takes deep breaths, hoping it passes. But after a few minutes, he starts sweating. His instincts tell him this isn't normal. Because George watched a video like this one, he knew what to do next. He reached for his phone and called emergency services immediately. That simple act saved his life. If our step 2, call for help without hesitation. Dial 911 or your local emergency number. Tell them clearly, I think I'm having a heart attack. Do not drive yourself. Do not wait for someone else to confirm. Trust your instincts. Emergency responders are trained to reach you fast and treat heart attacks on the spot. Their vehicles carry oxygen, defibrillators, and medications that can open blocked arteries. If you're alone, unlock your door before sitting down. Keep your phone on speaker. This ensures paramedics can enter quickly if you lose consciousness. Once you've called for help, move to step 3. Take aspirin if your doctor has previously advised it. Chew 1 full tablet, and it helps thin your blood and slow clot formation. Always chew, never swallow whole. It acts faster through absorption in the mouth. But if you are allergic or on blood thinners, skip it. Follow medical guidance only. It's wise to keep a few aspirin tablets in easy-to-reach spots at home. Next is step 4. Stay calm and reduce strain on your heart. Sit upright or recline slightly. Avoid walking, bending, or moving too much. Focus on slow, steady breathing, in through the nose, out through the mouth. Your calmness helps your heart use less oxygen while you wait for help. If you start to faint, lie flat and raise your legs slightly to keep blood flowing. Remember, panic makes the situation worse. Stillness and focus buy time. Now, step 5. Avoid misinformation. There's a lot of it out there. Ignore myths like clocked CPR. It's not effective for real heart attacks. Don't drink water, don't slack your chest, don't delay. Focus only on proven steps. Call for help, chew aspirin if advised, stay calm, and wait for professionals to rescue. We'll continue next by exploring what happens in the body minute by minute during a heart attack. Understanding this helps you know why every second, every action truly matters. Stay tuned, your heart deserves this knowledge. Inside your chest, the heart is a remarkable machine, but also a delicate one. It works non-stop, pumping oxygen-rich blood through 60,000 miles of vessels. When a blockage occurs, part of the heart muscle begins to suffocate from lack of oxygen. In the first minute, the heart senses distress. You may feel pain, pressure, or anxiety. By minute 3, cells in the affected area start to weaken. Your pulse may quicken. By minute 5, electrical signals may become unstable. This can trigger dangerous rhythms. By minute 10, muscle damage begins. That's why every call made quickly saves muscle. Doctors call this period the golden minutes. Intervention here prevents irreversible harm. That's why your calmness, your phone call, and your stillness are as vital as any medicine. Let's explore what happens next, Priest. When help is on the way and you're waiting alone. This waiting period can be the hardest. The fear, the uncertainty, the quiet around you, in these moments, focus on one thought. Help is coming. Every breath is a victory. Keep your breathing rhythmic. If you have prescribed nitroglycerin, take it as directed. Do not take extra doses or new medications without a doctor's advice. Some people lose consciousness during severe heart attacks. That's why unlocked doors save lives. Emergency responders can reach you faster when they don't have to break in. Now let's step into the shoes of another survivor. Evelyn, age 72. Evelyn was reading one morning when she felt a strange heaviness in her shoulders. She stood, tried to stretch, and suddenly grew dizzy. Her heart began to race. She recognized the signs immediately and called for help before panic set in. Her paramedics arrived within 9 minutes. She later learned her artery was 95% blocked. Doctors said, if you had waited even 5 more minutes, the outcome might have been different. Evelyn's story shows how recognizing and acting quickly can rewrite fate. So, how does the heart begin to heal after the attack is stopped? Let's look at that. Once blood flow is restored, damaged cells begin to repair. But healing takes time. Doctors use medications, oxygen, and sometimes stents to keep arteries open. Recovery isn't just physical, it's emotional too. Many survivors feel fear afterward. They worry. Will it happen again? Will I be strong enough? These feelings are normal. Doctors recommend cardiac rehabilitation programs. These combine exercise, counseling, and education. Participants who attend such programs lower their risk of another attack by nearly half. Now, let's go deeper into what makes heart attacks harder to detect in older adults. With age, nerves become less sensitive. Pain may feel dull or even absent. That's why many seniors confuse heart symptoms with muscle pain or acid reflux. Certain medications can also mask pain, especially those for diabetes or blood pressure. This is why regular checkups and open conversations with your doctor are vital. If you ever feel strange fatigue or chest pressure, report it AMS, even if it fades quickly. Now, let's talk about an invisible enemy that worsens every heart attack: stress. Chronic stress raises blood pressure, triggers inflammation, and strains your arteries. Over time, this weakens the cardiovascular system, setting the stage for heart failure. Simple relaxation routines like slow breathing or gentle meditation can protect your heart. Even 5 minutes of calm each day can reduce your risk dramatically over time. Now, imagine you're recovering at home after an attack. What should you do in the first week? Rest, but don't remain completely still. Move gently every hour or two. Eat small, balanced meals, rich in fruits, vegetables, and fiber. Drink plenty of water. Avoid caffeine and alcohol unless your doctor says otherwise. Follow your medication schedule exactly. Even missing one dose can affect recovery. If you feel chest pressure or fatigue again, contact your healthcare provider immediately. Your heart is healing, Faf. It's strong, but it needs time and care to rebuild. Now, let's talk about one often overlooked factor: sleep. Poor sleep increases inflammation, disrupts hormones, and puts extra pressure on your heart. Aim for 7 to 8 hours each night. Rest repairs both body and mind. Keep a cool, dark, quiet environment. Avoid screens before bed to help your body relax. If you snore loudly or wake often, ask your doctor about sleep apnea monitoring. It's linked to heart disease. In the next section, we'll explore diet and your most powerful daily medicine. What you eat shapes your arteries, your energy, and your longevity. Stay with us. This could change the way you look at every meal you take. Food is more than fuel. It's medicine or it's poison, depending on what we choose. Every meal you eat has the power to heal your arteries or quietly harm them. Let's start with what helps. Leafy greens like spinach, kale, and broccoli strengthen blood vessels. They're rich in nitrates and antioxidants that relax arteries and improve circulation. Next, omega-3 fatty acids found in salmon, sardines, and walnuts support heart rhythm stability. They reduce inflammation and help prevent plaque buildup in your arteries. Whole grains like oats, barley, and brown rice help lower bad cholesterol levels naturally. They provide fiber that cleanses your bloodstream of excess fat. Berries, blueberries, strawberries, raspberries are rich in antioxidants. They protect your arteries from damage caused by stress and pollution. Now let's talk about what to limit. Salt, sugar, and trans fats, the silent saboteurs. Too much salt raises blood pressure, straining the heart over time. Excess sugar causes insulin spikes that inflame and damage your blood vessels. And trans fats found in fried foods and processed snacks clog your arteries like cement. The good news? Every healthy switch you make pays off almost immediately. Within weeks, your blood pressure can drop, your cholesterol can improve, your energy can rise. So take small steps. Replace butter with olive oil. Swap chips for nuts. Choose water over soda. Each change rewrites your future. Each choice strengthens your heart. Now let's turn to something equally important: movement. The heart loves activity, but after 60, the right type of movement matters most. Experts recommend at least 30 minutes of gentle exercise 5 days a week. Walking, swimming, or cycling are excellent because they strengthen the heart without straining it. If walking outside feels difficult, start indoors around your home or up and down a hallway. Stretch your arms, rotate your shoulders, or stand up slowly every half hour. These small actions keep blood flowing and prevent stiffness. Remember, the goal isn't to move fast. It's to move consistently. Now, what about early warning signs before a major heart event? Doctors call them prodromal symptoms, small warnings that can appear days before an attack. These may include fatigue, indigestion, jaw pain, or shortness of breath when climbing stairs. Some seniors report waking suddenly at night, feeling breathless or sweaty. Others feel tightness in their upper back, or mild nausea that seems unusual. These warning signs are subtle but critical. Don't wait. Get checked immediately. A quick blood test, or ECG, can reveal whether your heart is under stress. As we age, our thirst mechanism weakens. We may not feel thirsty even when our body needs water. Dehydration thickens blood, making it harder for your heart to pump efficiently. Make hydration a habit. Sip water throughout the day, not just when you feel thirsty. Herbal teas, clear soups, and fresh fruit all contribute to your daily hydration. Avoid sugary drinks or excessive caffeine, which can dehydrate and raise heart rate. Now, one important note: loneliness and emotional health also affect your heart. Studies show that seniors who feel isolated have a 50% higher risk of heart problems. The heart thrives not only on oxygen, but also on connection and kindness. Call a friend, visit a community center, or share a meal. Every bond strengthens you. Human warmth lowers stress hormones and helps blood vessels stay relaxed. Your heart literally beats more evenly when you feel cared for and supported. So take this as your daily prescription. Eat smart, move gently, and connect deeply. Please take a moment to like this video and subscribe to our channel and click the bell icon. Your support helps us bring more life-saving awareness to people all over the world. Take really care of yours and your loved ones. See you in the next video.